cooperation. Isha Thakkar was subtitling all the videos. She was residing far away also, but then also she has done the thing. And all our patients and all the participants, whoever has attended this, thank you very much for now. And if you have any of the question, you can ask, please. I am stopping my screen sharing, so you can ask the question, please. If anybody has any questions regarding any specific thing, you can unmute yourself, please. Any one by one, if they can unmute, it will be the best thing. Whoever want to ask question can unmute. Dr. Gaurang, hi.
How are you, sir?
Fine.
I think there are some questions and maybe you can answer some questions that they ask. Shushti, can you coordinate and just go on with the questions?
I request all to not to, yeah, please.
A participant has asked, how do you define the word projection?
Beg your pardon?
How would you define the word projection?
Word projection. Projections means whenever we project ourselves on other, any of the quality, whatever we project on other people, that can be used as projection word. Or we are not talking about the word, but the projection as a process.
Okay. So another participant has asked, when patient is not cooperating, what to do, how to ask?
When these are the non-cooperative patient, what you are talking about. Okay. Hello.
Yes, sir.
So mostly in non-cooperative patient, our patience is the best thing. Our attitude toward them, plus the information which we are getting from the relative of the patient. These are all most important part. And what they are what we call they are actually why they are non-cooperative or uncooperative, that we have to find it out very clearly. Then it will be easier for us to have their cooperation also. Many of the medical doctors or consultant, I have my cases that they are non-believer of homeopathy. They may not give you much details about the mental also, but when we make them understand about the whole process of homeopathy, mostly they are ready to give the details. Yeah, please.
So next question, what is the importance of repetitive words in case taking?
Beg your pardon?
What is the importance of repetitive words in case taking?
If the repetitive words are coming frequently, more than almost 20 times, then it should be explored. Otherwise not. And if the words are coming with all the gestures also, then it can be pay heed to. Otherwise, common words have no almost importance in the case taking. So I am not actually focusing on only words, but the whole essence of the things. Not go by the words, no, not go by the gestures, don't go by the any of the theme or anything. Take the whole totality from the cellular level to the soul level. That is what the center. Yeah, please.
So participants are asking, what is the importance of hand gestures?
Hand gestures are actually the non-verbal communication. Our almost very big part of the communication is non-verbal communication. So that can be used for the case taking purpose to understand the depth and the energy patterns also. That you have to understand first the neuro-linguistic language as well as the non-verbal communication methods. Then it will be easier to understand the use of hand gestures.
Okay, the next question is, how can one understand about unknown self?
Unknown self. Yeah, this is one of the most important part and very difficult part also. It requires a lot of practice to become aware. Self-awareness is only the way, no other way.
They are asking all PhD level questions. Huh?
Beg your pardon?
They are asking all PhD level questions.
Yeah, yeah. Even I am doing my PG in almost case taking, that is PhD in case taking also, and I am working on this question also, how it can be very useful to the self-awareness. That is almost parallel to mindfulness of medicine, meditation.
My God.
Any other questions regarding?
So what does spontaneous denial signifies in a patient? Does this mean
Spontaneous
patient is
denial?
sensitive to that question?
Yeah, they are sensitive to the issue, not the anything, but whatever they are denying, the issue they are denying, they are completely sensitive to. We have to check that, palpate that sensitivity. That will lead us to some of the characteristic expression of the patient. That can help. Basically, what I understand, that whatever comes very spontaneously, in homeopathic case taking, it is one of the most important part. So homeopathy has to be spontaneous first. Even choosing the case paper to the choosing the remedy sometimes.
So participants are asking about the books they can study to learn more about the talk you gave today.
Okay, so it is a not one book. It is there. There are numbers of books that I have already mentioned, from the Organ of Medicine onwards to the latest book of Alistair Gray, probably from the case taking. It is a book name called Case Taking, probably written by Alistair Gray. So this, all the books can be useful. All the cases are important. No specific book I can recommend, because I have almost studied from the various books, and I have tried in my practice. Actually, this, all the things, whatever I have tried in my practice, the patient has spoken the things, and patients are the real teachers for me. That is what my constant experience. No doubt my teachers, my very good friends always guided me very well, but at the same time, if I don't put it into experiment with my cases, how I can practice it properly? So whatever we are learning from our books, from our masters, from our seminars, from our colleagues, that we have to implement in our cases, and that cases will make you learn more. This is what my experience, at least.
Okay.
Even Dr. Gaurang can say more about it.
I want people to listen to you, because
Okay, thank
your experience is what I want all of them to know. I just wanted to introduce about your experiences to them. I will be taking many sessions for them. They'll get bored.
So actually, I almost, I have tried my best to remain most spontaneous during the whole course of time, and that is why even I have forgot to record the session also, no doubt. But I have remained fully spontaneous with the whole presentation.
We will have the recording, don't worry.
Okay, no problem. Thank you. So any mistakes I have done, that is also on my part. And if I have done very good thing, then it is also my part, because I remain very spontaneous. As if I am explaining to my students who is sitting in front of me. That is how I have tried to explain. Maybe some of the internet issues are there, so I cannot show you the actual cases, because I have to subtitle it. I have to select the Hindi medium cases, because so there are so many cases of my mother tongue, but that you will not understand it properly. That's why I have not chosen it for this presentation. So any of the question, you are free to ask whatever.
Okay, so participants are asking about some tips for neonatal case taking.
Neonatal case taking, observation is the only case taking, nothing else remains. Neonatal case taking, mostly such cases can only be observed properly with the history and the information from the patients, parents. That's all. You cannot ask anything of the neonate. Yes, you can feel. I always practice that method, no doubt, with very good intention and very good what we call healing intentions. I generally rub my palms, put my palms on their abdomen or head or feet to know the temperature and the feel of the patient. That generally I do. Especially in neonate, this is possible. So probably birth history and mother's pregnancy history also important. Yes, it is really important. Recently, I have a case of what we call hypoxic problem, and because of the delayed labor, he has not cried for 1 month, and they have started homeopathic treatment after the 1 month of the delivery, and now the child is almost playing. His landmarks are developing very nicely, and everything is good with the development of the child. But in the before, almost after the birth, in 1 month, he was not even crying, not responding to the sound also. His physio is going on, his neonatal specialist is also doing well, but he has stopped all the medication and now only is on the homeopathic medicines. And almost he is of 9 months now, and developed most of the landmarks very nicely. Reserved personality, just I am checking it. No, reserved personality, you have to be with them and make them more expressive. Any other question? So somebody is asking about the illiterate patients. I am really interested in this question because illiteracy, what we call illiteracy, because literacy and educations are both two different things. Literacy means we have all certifications, and educations means we know. So the people who are not literate know much more than us sometimes. They are they are very wise people in my experience. Even though they have no education at all, they are very wise. They are very educated in a real sense. And many of the very literate people are completely uneducated. This is what my findings. Maybe completely I am projecting or denying something, but there are chances. Mental symptoms in pathological case. So you have what to do. Somebody has wrote down there what to do and mental symptom in pathological cases. Bonninghausen has already defined the concomitants, that mental concomitants with the physical complaints are one of the most important part. Yeah, in hypochondriacs and anxiety patient, we have to bear with them. We have to be very attentive to them. Even I am this corona situation, I am getting more calls from the this kind of the patients only. And real patients are not calling much, and they need scam first. So any of the relevant questions are most welcome, and you can ask whatever you like. Purposefully, I'm not giving the name of the remedy because it will mislead you somewhere, or it is not the actually intention of this session. So it is not that much important. And remedy always is not that much important. The process is one of the most important, and it is almost joyful one. With each case, whenever I come in morning to my clinic and I have no new cases, I always be very joyful that I will meet a novel or unique today. And mostly this do. Hardly in a week we prescribe the same remedy for almost 3 4 patients. That is not possible because each individual is different. Analysis of the case is not the actually intention or the purpose of this session. That's why we will not go into the analysis of the case. Already I have given you the 3 documented cases. In one case already I have shown you the sum of the part. You can analyze it, you can repertorize it, you can have the details, and if you say, I will send it you the whole analysis of the case also, because I have done it all through transcript. Any question?
I think we'll call it a day for the questions, because maybe they can email you the questions.
Yeah, sure.
We couldn't. So you can think about answering them personally if you get the time. So
Yeah, sure. You can give my email address. That is drashishchimeta@gmail.com.
Perfect. Perfect. So I just want to thank you, sir, for being part of this this session.
It is a real privilege. It is a really enjoying thing to be with you and with all the homeopathic learners. That is what actually we need. Somebody interested in homeopathy. This is what the need of the day.
I don't think there are many students here who are all across India. Some doctors are from Europe. These are all mainly students, interns, early practitioners. Many of you may not know, but Dr. Ashish Mehta has been I think now the ex-principal of the college. Am I right?
Yeah, I have almost left the principalship.
Okay.
Because of the non-interesting student towards homeopathy only.
Okay. So why the reason why I'm saying this to our participants, because you have through so many years, many decades, seen the education system, and my favorite thing about Dr. Ashish Mehta is that whenever I would take lectures in other song in Mumbai in seminars, and if there would be doctors coming from Gujarat, and there would be at least in every workshop at least 3 or 4 really very interested students, and if I would ask them where are you from, and they would say Bhavnagar from Dr. Ashish Mehta, and they will always have that kind of a stamp on them that they have learned from you, whether it's Dr. Ram Krishna or so many others who I've seen. So every student of yours who has learned from you, they have a stamp of that kind of very humbleness, but a lot of passion towards homeopathy that you embark to your students. So it's such a pleasure, and I wanted you to inspire our students about your work. That's why I wanted to invite you, sir. Thank you so much for taking the
Thank you very much.
time.
It was real pleasure to share with all of them.
So one last question before you go.
Yeah.
What is your advice to young students who have started their practice or just about to start their practice? What should be 2 or 3 things that you wish you knew when you were in your internship or your early part of practice? What is one thing that you could tell them?
What I have adopted, that is first, is the patience. The first thing in starting of the homeopathic practice, I have adopted patience. Second, how to use this period by reading whatever book which is important to me. No doubt at that time, I don't know that which kind of the books are very important to me. No doubt I started reading organ of medicine for the first time after studying during my waiting period, because I have started in almost 89, 1989. So at that time, homeopathy was not so good at my place also. So almost per day, one patient I was receiving, and sometimes one follow-up only, no new cases at all. So at that time, I go on reading Organon of Medicine, then Materia Medica, then after Borike, I shift to the Materia Medica Pura also, then chronic disease. This all sort of the whatever textbooks which is I have in my college life. And then started almost exploring how many good homeopaths are already available in India also. Because one of my very good friend, my almost classmate, was training at that time under Dr. Shankaran, Dr. Nirav Shah from Rajkot. He was with Dr. Shankaran. Another student who was studying with me is under the training of Dr. Prakash Kothari at Baroda, who was one of the best ICR student of Baroda. He was under that, and so I was at comparatively far away place. So I started reading all the books and communicating with various kind of the masters. Among them, Dr. Chitkara I have communicated, and he has invited me for 1 week. I have sitted with Dr. Chitkara also, H.L. Chitkara probably is. He has converted the Mind Rubric, a book named Mind Rubric. First time it was been introduced, and most of the that ROH of Dr. Segal's concept was with the Chitkara also. So this is how I have learned. With Jugal Kishore, I met once or twice. Even I used to write postcard to Dr. Rajan Shankaran also about my questions. Postcard, I was writing postcard at that time. So it was available at that time. And he was answering also. That is what my surprise. So these are all the travels. Even I wrote to Shalton also, wrote to Ananda Zeren also. Various, whatever they are almost, we are reading from the various, what we call magazines. Dario Splendly, probably name, whether I am pronouncing right or not.
Dario Spinardi from Switzerland.
Yeah, with him also I have a communication regarding the rubrics, especially the Conchlis rubrics and the objective symptoms. This all I have done many a times, and this is what I can say. It is not only patient, it's not only hard work, but some sort of passion is there. That still it is remaining, and still I am going and learning.
That we can see in you even now, the passion that you have, the humility that you have. That is something that is there in you, and that I think we all have to learn from you.
So the patience, hard work, and passion, that three PHP will be the better thing. There is a platform also, computerized portal also, PHP, that is patience, hard work, and passion. Do it passionately. Everything will come. Nothing will go away.
One of the biggest thing about Dr. Ashish Mehta, he's so humble that, I was in my late, I mean, I must be 28, 29-year-old a few years back. And that time he had invited me to his college to teach, and he was attending in that. So it was almost like I was less than half of his age, and still he had the humility to invite me and listen to me talking. And it just shows so much of humility. I don't know if I would have done that. So that's something so inspiring about you and so amazing about you, sir.
Let me tell you one secret. That was not humility. It is eagerness to learn from you also, because the learning comes from anywhere. It is not from any masters or any of the thing. We can learn from anybody. And if we can learn from anybody, this is best for our patient. Basically, it is for our patients. Whatever we know, we have to use it for the patients.
Absolutely. So that's it from all of us. We really want to thank you, and I think students really were inspired today about your talk. Okay. And I hope we can invite you again, and you can inspire our people even more. Thank you so much.
Thank you very much. But please give me time some, because this corona has very busy time nowadays, because so many cases and so many relatives are also in hospitalized. So we need your support also during those pathological cases. I will tell you
Whenever you
also.
need my help, you just email me. I'll help you. I'm
Sure.
treating.
Thank you very much. Thank you all the participants for your patience and your passion to learn homeopathy. Thank you very much.
Thank you.